Everyone being here. Ever since my son, RJ, was a little boy, he wanted to serve in the military when he grew up. When he was younger, he was in Boy Scouts, played sports, and he was in the Young Marines. When he was in the Young Marines, he actually got to go to Quantico and Parris Island in the summer for drill. When my son turned 17, it became noticeable that he may have had an issue with alcohol, so I took him to rehab. Because of the laws that we have in place today, anyone over the age of 14 can refuse medical treatment, including my son. I called Children and Youth Services. They said call the Pennsylvania State Police. I called the State Police. They said call Children and Youth Services. I had to wait to have my son arrested to try to get him help. My son died June 30th, 2008. From a combination of alcohol and Suboxone. He was 17. He wasn't prescribed Suboxone. He was at a friend's house one night with his friends and they were drinking. He never received the court-ordered treatment, and my son died within 4 months of me initially taking him to rehab. Today, I believe a parent can petition the court and have it mandated. I find it difficult to understand that if I'm responsible for my child under the age of 18, why I need to go to court to petition that my child get help. At the time of my son's death, most parents, including myself, did not know that the kids were experimenting with prescription pills. None of the kids knew that they would become addicted or become heroin addicts. My son didn't know that he would die. I quickly found out about Suboxone and all the Suboxone doctors, more than I ever wanted to know. We have 13 Suboxone doctors in our county, and only a small handful are actually associated with treatment. The rest are regular MDs that you can go to if you have the cold or the flu. I have yet to meet any other addict that has come back and said that they actually sought out Suboxone to get off of heroin. Most use it when they can't get heroin. And their parents are willing to pay the $500 cash to walk in and get a prescription of Suboxone. The doctors, I've heard from other parents, the doctors tell them, we don't want to run this through the insurance because you don't want that on your child's record. In the past 8 years, I've witnessed and heard a lot. I've watched my son's friends and so many young adults in our small community in southern Chester County become addicted to pills, heroin, struggle with treatment, and die. One of my son's childhood friends is buried in the plot next to him. They went to daycare together. In 2014, I saw a program that blew me away, and I knew that we needed to have it. With the Holcomb and again the DA's office, we started a chapter of NOPE in Chester County. I'm also the parent coordinator for Chester County. NOPE is a 501c3 formed out of Palm Beach County in Florida in 2004. And their mission is to diminish the frequency and impact of overdose deaths through community education, family support, and advocacy. The cornerstone of NOPE's mission is a personal, high-impact presentation. And again, we do deliver them to middle and high school students throughout the school year. The message is delivered graphically and emotionally. Following most of our presentations, a number of students seek help either for themselves or someone else, or they go to guidance to speak with someone because they too have been affected either by addiction or loss. Some of our other NOPE family members have had students who viewed the presentations that actually afterwards write letters, post on the NOPE website thanking them for coming to the school, saying it was the best program they've ever seen. They've never seen anything like it. The students are starting with drugs coming from home. Yet in most school districts, we can't even get parents to attend the community presentations because it won't happen to their family. If it was a ski weekend, I bet you the parents would be lined up out the door. Prior to this program coming into the schools, no one was talking to these kids. Not in this way. We sometimes hear the students comment as they're walking in, "Oh, it's another drug talk." By the time they leave, they have a very different opinion. I've seen some of those same students walk out in tears. This program isn't a scare tactic. This is reality. These are parents with actual children that are lost within our community. After the age of 13, children are no longer required to attend daycare, but they still need to be monitored and supervised by adults. We spend millions of dollars on Head Start programs for low-income and minority groups, but we don't have programs for the ones that we're losing. Around the age of 13 is when most of these problems with our adolescents seem to start. Schools are where the drugs are coming into, and this is the age where they have the lowest self-esteem. We need after-school programs for these kids. They don't need lectures. Not every student is a scholar or athlete. We need something for them to do to be able to be children. They will do dumb things. They will not think sometimes, but they still need to be teenagers. They're caught between an age of being an adult, and we expect them to behave that way. And I think we need to just get rid of that mentality. They are not adults. Since my work with NOPE, I've had parents and family members reach out to me looking for how to help their child. And it's the same all over, as I'm sure it is in every one of your districts. The treatment beds are full. Insurance deductibles are an issue. Now we have new issues because some of these children are over the age of 26 and they're no longer eligible for their parents' health insurance plan. It takes days to get them into an assessment just to apply for county or state funds for treatment. That window of opportunity of them wanting to get help is gone within 24 hours if you can't find someone out. The addicts need to use or they get sick. So waiting more than 24 hours is going to do nothing for them. A lot of them commit suicide or die from overdose before they can ever get treatment. In December, we lost 2 former students from our small school district. In March, this past month, we lost another 3, all under the age of 28. If my son would have actually lived to his senior year, his graduating class of 2009 has lost 5 to overdoses and another 2 related to drugs. Now, on September 11, 2001, there were 4 planes that went down with 300 plus people on board, each plane. And this country demanded that we do something. And I'm here to tell you that hospitals in this county, on average, as Ethan had said, see 1 overdose every day. That's 5 people a day. That's equivalent to 1 full passenger plane of our young people. They may not die, but they're addicted and they need help. If it wasn't for naloxone, most of these overdoses would be deaths. Would we be more concerned or move quicker in addressing these issues if those numbers were higher, the actual overdose deaths? But we really don't know because hospitals aren't mandated to report these overdoses. But we're required to report the 4 cases of Ebola to the CDC. We have technology in place that can be utilized. With the fentanyl that's already out there and the W-18 that's coming, we don't have 6 to 12 months to pass legislation. We have laws and policy in place today that were put in place 20 years ago with good intent, but they no longer apply to the issues that we're facing today. If these laws were in existence when I was a teenager, there would be quite a few people that I know in good positions that would be unemployable today. I'm not saying that we shouldn't hold people accountable. Give them community service. Make them pay a small fine. Maybe they'll surprise us and obtain employment to pay for their fines. We need to start making the punishment fit the crime. We have zero tolerance policies in place in schools. However, if you ask a lot of the schools in this area, they don't have a problem. Maybe this is because students are expelled or sent to alternative schools, and they call the police. I'm waiting on a report from our Pennsylvania State Police to see how many times they've been called into some of our schools and for what the purpose was. Most of the times it is drug-related from what they've told me. And I think that most of us can agree that we can't arrest our way out of this problem, but we have our school systems that are putting our children in the system, and they're not getting help. There was a study published by the American Journal of Public Health, and the authors found that students attending schools with suspension policies for illicit drug use were 1.6 times higher likely than their peers at schools without policies to use marijuana in the next year. And that held true for the student body as a whole, not just for the kids that were suspended. This only makes drug use worse and the epidemic thrive. Children need treatment and education in schools. They need someone to talk to, not to be suspended or removed and sent to alternative schools like they're a village idiot. They don't want a lecture. They want people who care, that understand, and willing to listen. Unfortunately, we are not seeing this in the schools. As adults, we're responsible to protect them. We've failed these children, and we cannot continue at the rate that we've been going. There are laws that can be repealed. Simple drug possession laws prevent people from gaining employment. We have limited liability laws that can be petitioned, but you have to wait 3 years for that to happen. 1 year should be sufficient. We need to empower people, not knock them down, and pay for their addiction for the rest of their lives. But they will with the laws we have today. How do we expect someone to change when we don't give them a chance? Sitting on their parents' sofa unemployed isn't going to make them feel any better. For any normal person that's been laid off and out of work for a few months, ask them how they feel. This is a horrible way to treat a person who's an addict. We have a system that sets them up for failure, and they do want to be independent. They need money, and we're surprised that they sell drugs and they can't stay clean. We need to treat low-level, nonviolent drug crimes in a completely different manner, maybe similar to a traffic ticket. Give them probation, mandate that they get treatment. Again, let's make the punishment fit the crimes. We have a naloxone and 911 bill, but most people don't know about it. With our program in NOPE, we do tell the students about that. We've passed a law, yet young children and adults aren't even aware that it actually exists. Every election, I see incumbents running for office with billboards everywhere I go. Yet I see nothing to advertise these laws that could save lives. I understand that government isn't in the business for marketing, but there are resources out there that can help do these things. Last year, 2 other mothers and myself held a vigil on Overdose Awareness Day. We had 3 billboards throughout Chester County, digital billboards, the huge ones, donated to advertise our overdose vigil. All I had to do was call and ask. There are things that can be done, and most of us here today have been on the forefront talking to other addicts and families, and we've witnessed these issues ourselves when we've tried to help people. The world stopped for 3 days when there were 4 cases with Ebola in the U.S. Hospitals are required to report those cases to the CDC, but we're not mandating that they report overdoses. We already have systems in place. Why aren't we using them? We mandate that schools implement standardized testings and regulations, yet naloxone was offered to 500 school districts in the state of Pennsylvania, and only 20 or 250 carry it when it was offered for free. What does this say? Only until we fix the holes in the system will things start to improve. Not only is addiction devastating families, but this is a drain on resources and our economy, as was mentioned in the prior panel. We are losing our future. There are ways for mass treatment, but that may involve using federal resources. Rehabs are a revolving door, and they've failed. We shouldn't be surprised because there are a lot of places that charge $10,000 a week just for room and board in a treatment facility. That's what a college charges for 1 year for room and board in a dorm. So we're surprised that insurance companies don't want to pay for more than 10 days of treatment. We spend over $30,000 a year to house an inmate. Why aren't we using that money on mandated long-term treatment? Using federal resources, they could be contained, but not locked in a jail cell 24/7. We can treat them, teach them job and life skills that they need to be successful. If we can keep them there for a year, when they're released, wipe out their record, let them start a new life, and relocate them, because most who use, when they come back to their community, it's people, places, and things. I have not seen very many successful stories out there. There are some, but not many. My husband is a contractor, and every year he has to pay fees and renew his licenses just to work. I think we should do the same for the medical community, that can build a fund for treatment and educate them at the same time. We can educate the medical community as a whole overnight. Instead, we've spent the past 5 years trying to figure out how to do that. It seems that the only people that we're holding accountable for our actions are the addicts, not ourselves. We're more concerned about what the doctors may think, or if we pass a law that they might be upset. School administrators are more concerned about how they look to the community. This is a national epidemic, and we need to treat it that way. We have spent at least the past 5 years that I've seen dragging our feet. We don't have another 2 years, let alone 6 to 12 months, to make changes. It breaks my heart every day when I hear of another family that has lost their child. There are actions that we can take to be responsible to protect them. We've failed these children, and we cannot continue at the rate that we've been going. There are